This is Lee Dickman from Oberlin, Terry's from Hayes, Janet and Dave, and Janet is going to kind of help with some of Dave's introductions. And then Kelly Craighauser is a social worker, and then I will be on the panel also. So I'll get a chair.
I'm good, Steve.
Are you sure?
Yep.
So you get to be first.
I'm good. Can you hear me? I'm Terry Isbell. My wife, Mary Jo, is in the back there. We're from Hayes. And my journey began when I was little. I was born with a connective tissue disorder. It turned into a marfanoid habitus, they call it. It's kind of like Marfan's. I don't know if you know what that is. Michael Phelps had that. He's got double jointed long arms. But the characteristics of that lead to some interesting things. And so one of them is skeletal deformity. I have a pectus excavatum, which. Okay, can you hear me now? Okay. All right. So as a result of that, later on in life, I had to struggle with dysautonomic issues. When I was in high school, I had dizzy spells, turned into vertigo and some other things that they couldn't figure out what was going on. So as I progressed through life, one of the things I had to do was come home from work when I was 32 years old. As a result of that, I got the opportunity to be on a drug called olanzapine. And unfortunately, one of the things that olanzapine can do is it can cause Parkinsonism. And so at one point in my life, I had to see a neurologist about Parkinsonism. Coincidentally, my father had Parkinson's at the same time. And he progressed to the point where he eventually passed. And so one of the things that they diagnosed me with was that I had drug-induced Parkinsonism based on this drug that causes the Parkinson's. And so one of the things we did was we got off that drug with the hopes that I would recover and that I would be able to not have idiopathic Parkinsonism, but have the kind that where the receptors would go ahead and open back up and I would be able to recover. Well, that didn't happen. Unfortunately, I have the real thing, the idiopathic Parkinson's disease, meaning they don't know what caused it, but my area of the brain that produces the dopamine is damaged. There's some question as to whether the olanzapine caused that or not, or whether it was something that the rest of us struggle with. The bottom line, my father, who had the Parkinson's, and I have the Parkinson's, coincidentally, have two different sets of symptoms. He started off where he had the terrible nightmares and not that type of deal. And so listening to Dr. Suni today, it became apparent to me that he probably had that vector where it went through the gut because it went up the vagal nerve into the lower part of the brain, causing them the nightmares. I didn't have that. I had the loss of smell early on in my journey. So obviously the vector went through my nose. And we checked the genes and we don't share any of the genes. And so it's pretty apparent to me that he had the one vector and I had the different vector. But anyway, so eventually I got to the point where I was catatonic for about half the day. My symptoms were such that I could take the Parkinson's medication and it would allow me to perform for a period of time, but I had about a 45-minute crash after I would take my medicine. And so then after I would recover from that, I would be better than if I didn't take the medicine. And I could produce for about 2 hours, but then I'd start to crash again. And so then I have to start the process all over again. So within a 4-hour period, 2 hours, I was crushed. So 50% of my time I was catatonic, rigid, couldn't move. And so the motor fluctuations, that they call that, one of the things that you can do is take DBS, which Elaine did. And she encouraged me to pursue that. And so that's one of the things I did. And I was one of the fortunate people to be approved for the DBS surgery. So we scheduled it for January 27th this year. And I was going to go in there and have the DBS through Kansas University program, which is a wonderful set of people. And 2 weeks before my surgery, this department my Kansas University neurologic team approached me about trying the Violev transdermal infusion pump, which is where I get the medicine pumped through a small tube underneath my skin. And they wanted me to try that first rather than go through the DBS. So I had a choice. I could try this new pump with a little wire, or I could have brain surgery. So I chose the pump. I got approved on a special Medicare basis, 8th bill. So that was wonderful. So they put me on the pump. The idea being that if it didn't work out, I could always go back and do the DBS. And I have a 1-year coupon to have brain surgery within a 1-year period of time if the pump doesn't work out. So for the last 6 months, I've been using this pump. Is anybody else using the pump therapy? Anybody here? There's 3 different pumps, turns out. There's a Duopa, there's a Violev, and there's an Agapro, something like that. The Duopa has been around a while, and it goes into the intestines. Basically, it's the carbidopa levodopa medicine that we all need, delivered as a gel, bypassing the stomach. The idea is that because it's not going through the intestines, that you get a more steady, continual dose. And so that has been around for a little while. When they approached me with this Violev, it was transdermal infusion. That means it's going under the skin. That's a little bit more tolerable. Like the feeding tube in the intestines versus under the skin. I wanted the skin, but the thing about it is that it gives a precise amount of medicine on a continual basis. And so there's a baseline that frees me up from that lasting roller coaster that I was on, of the on-off 2 hours catatonic, 2 hours producing. And so that part's been wonderful. The diabetic crowd, I don't know if there's any diabetic people in the audience that have the pump, but they have the pump for the insulin. Same thing, delivering a constant continuum set of insulin, and they've been doing that for years. So the Parkinson people tried that with the carbidopa levodopa, and it's called carbidopa, levodopa. And what that is a different molecule, but it's the same drug basically, delivered from the pump through small tubes under the skin. And there's a little spot that you place on your skin, and you push this little mechanism, and it shoots the little needle into your skin, and then you attach this tube to it, and it's called a cannula, that site, and you wear that. And so here's the pump right here. I got the version that doesn't play the 1970s music. But with this pump, I have the ability to use the baseline dose. And again, the key here is that it's a precise amount of medicine being delivered under my skin into my bloodstream, bypassing the intestines and the protein and all that stuff. You know, when you have to take this Cinemet stuff, you have to watch when you eat, what you eat, and all of the stuff. Well, I don't have to mess with that. It's just this constant, steady stream. The good news is that I have that baseline. The bad news is that I have to move this site every 3 days. And so I get to punch myself in a new site. It can get irritated. You can get infected. You can have trauma there. You know, when I create a new site, it creates a lump. And so you have to deal with that. Plus, I don't know if you noticed or not, I'm kind of skinny. You need fatty area to make this work. I'm kind of running out of territory. So I found a gold mine back here. So I get to sit on my canoe sometimes. But bottom line is that I get that steady stream. And so that on-off has been cut in half. I've taken fewer pills, but it's not, it's not all great because of the having to move the cannula, the infection, and irritation. To be quite honest with you, when I have a fight with the wife, my cannula will start to ping like a radar because it's painful, it's uncomfortable, but my stress starts to, it's like, it's like a toilet. The stress causes you to get tight, starts to ping, it starts to be painful. And so it's not all good. So bottom line is I'm still going to pursue the DBS, I think. I've talked to the folks in Colorado as well as people in Kansas, and there's a good chance that we'll use both. We'll use this and that's the surgery to try to gain some more territory. But the bottom line is with the pump, I'm able to get back. And there's times when I thought, I feel actually almost normal, and I hadn't felt that way in a long time. And so there's that. But there's still a challenge of having to move it around and those kind of things. It's not convenient. There's a syringe that you fill up every day and you stick it in the pump and turn it on. And that only lasts 22 hours. Well, that starts to become out of cycle. You get 3 a.m. in the morning, you're trying to change it. No, that doesn't work. So you have to go back on the pills. Well, geez, when you take the pills, you're in the roller coaster again. But back and forth. So anyway, there's a third option out there. It's a pump that they approved in the early part of this year. It's called apomorphine. It's the GoPro. And that's using that agonist drug, and it's delivered the same way. But instead of using the carbidopa levodopa, it's using the apomorphine, which is the one that stimulates the receptors as opposed to producing more. So it takes the brain out thinking it's getting the dopamine. But it's all three pumps, dual pump, which has been around a while for the intestine, Violet, which is the one that I have, which goes under the skin with the carbidopa levodopa, and then the GoPro, which is the apomorphine, that's just been approved. So with those three things, I can tell you everything you didn't want to know.
Hi, I'm Lee Dickman. I'm 70.
Oops, I don't think you're on. Oh, you are. See it.
Hello. Hello.
Is he on? Oh, trading. Okay.
Hi, I'm Lee Dickman. I'm 76 years old and was diagnosed with Parkinson's in 2009. I also have deep brain stimulators, or also called DBS, installed to control my Parkinson's symptoms. DBS helps control my Parkinson's symptoms. I'd like to say that I jumped right into having a deep brain stimulator device installed, but I can't because it seemed weird to me. I waited for 3 years before I got it installed. I could kick myself for wasting time. When I met with the surgeon, she believed that I only needed the left side device installed. Now we should wait to install the right side or second device at a later time. Big mistake on my part for going along with it. I should have had both sides done at the same time. It's surgery, and it's easier on you to go through it once rather than twice within 6 months or a year. Now, I'm not the best example for displaying the results. I have physical limitations, arthritis, frozen shoulders, foot problems, and back issues, on top of having Parkinson's. So I still have problems with movement, but that is not due to the DBS surgery. My movement has improved immensely by the surgery. The stiffness caused by Parkinson's greatly reduced joint pain and tremors. I continue to take medications to offset some of the symptoms, just not as much. That's the big picture.
Can you hear me? Okay. I started seeing symptoms in about 2004 and felt I was just too busy to worry about doctoring. And I was doing mental health with children, a lot of hours a week. Plus I was still working at the service center as a behavioral therapist for kids on IEP for behavior. So about 2 years after that, I started going to a neurologist, Went there 8 years. I also went to see that same person who saw my mother for Parkinson's and never got a diagnosis. Well, in 2015, Dr. David Van Sickle out of Littleton, Colorado, came to Colby. He'd done a program in Garden City, and he talked about improving your quality of life with DBS. Never heard of DBS. When mom had it, I should have known a whole lot more, but when I was working 40 to 60 hours a week, I was really involved with really my career and not my health. And so that day, at the very end of the presentation, we had a gentleman walk up to the front that he had done DBS. This gentleman is Dave Meidel. And he described him as a farmer, couldn't get on a tractor. He was had limited mobility, and he walks up to the front of the room, and I'm thinking, whoa. Well, 3 years later, Dr. Van Sickle came back. Now remember, I went from 6 to 2015 without a diagnosis. And I didn't notice because I didn't have a diagnosis. But boy, those 3 years after, I just started sliding backwards. And Dr. Van Sickle came again in August of 15. He took one look at me and he said, doesn't look like any of your medications are working. I was on 8 carbidopa a day and 1 rasagiline. And rasagiline has horrible side effects. And he said, I think it's time to talk DBS. Only one problem. I was doctoring in Kansas City. When I talked to my doctor there, he said, I am not ready to grant you DBS. Of course, if you know Elaine, I came up out of my chair and I said, this is my Parkinson's, not yours. And I have a neurosurgeon that thinks I need to have it done in my window of opportunity. I asked him, what is in your opinion, when is my window of opportunity? And he said 3 to 10 years. So in February of 18, when I had it, you were still talking 2 to 9 more years after that. And I said, I'm not willing to live with this disease and this quality of life. And when I decided to do DBS, Ken and I went out to Colorado and I quizzed him dearly. I want to know how many infection, what's your percentage there? I want to know how many brain bleeds you've had in all your surgeries. I want to know how many strokes you've had. He knocks on the table and he says, I can't guarantee anything, but I haven't had any since 14. Where do you think I want to be? In his hands. And so I had surgery in February of 2019. And I stayed, my husband said, that doesn't bother you? I think men see their brains differently than women. But I said, at my quality of life right now, I really don't care if I die on the table. Because I don't have much of a quality of life and I am headed downward fast. And so he never says much. We went out, we had the testing. You have to have a neuropsych test to qualify to see if you have any dementia. And you also have to have a test to see if your carbidopa levodopa is working. So when I went to Denver, I couldn't have any of it till I'd had the several tests. And then they sent me off and said, take your drugs, come back in 2 or 3 hours. And then they tested me again. And they said, you're a candidate. And I passed my neuropsych. It was not difficult, but it took me 4.5 hours. I had a headache after the first hour. And, I kept thinking, man, I'm dumb. Man, I'm dumb. But it really wasn't so much that, it was just intense. You just had to keep going, keep going. And you do a lot of pictures and you had to look at a lot of different things. And so when they told me I was a candidate, then Dr. Van Sickle said, I have to get you approved through your Medicare. And then they set a date and I went out. I was in the hospital only overnight after they did both sides and went home. The brain piece was a piece of cake. And I had the generators put in, and I think it's because I'm a woman, that tissue is much more tender. And I just couldn't roll over and I just couldn't get comfortable. And I probably was out of work 2 or 3 weeks with that healing. And once it healed, then I was good to go. And to be honest with you, it has been like a miracle for me. I do a DBS Facebook group, a Parkinson's group, a positivity group, and I find that not everyone has that kind of success. So that's my story.
Okay, I am Janet Meidel. This is my husband, David, and his voice is getting very soft with the Parkinson's. So he was afraid nobody would be able to hear him. So he let me do it. Okay. He first noticed something was wrong when I wrote it for him. So, okay. I first noticed something was wrong when my leg began shaking while I was sitting still. Then my arm also started shaking. In 2004, I was diagnosed with Parkinson's. At that time, there were no specific tests available to diagnose Parkinson's. It was basically a matter of eliminating other diseases that had similar symptoms. Then they tried the Parkinson's medicine, and if that helped with the symptoms, then you were diagnosed with Parkinson's. I did not enjoy eating out because I felt like everyone was watching me shake and judging me. I was building a sunroom and wasn't able to hold a screw in my hand. Walking was also a problem. Take a video of yourself walking, it may surprise you. All of that changed in March of 2015 when I had my DBS implant. When I got home, I stopped to see a friend and he could not believe the difference the DBS implant had made. My hands worked and I walked so much better. Now, 10 years later, the doctor says that my Parkinson's has progressed so much that the DBS isn't able to keep up with it anymore. It is still helping with the shaking and the other symptoms, just not the walking. I would encourage anyone with Parkinson's to seriously consider a DBS implant. I really enjoy visiting with anyone considering DBS. It truly is a miracle. And as Dr. Van Sickle says, don't wait too long. Why not enjoy life now?
What to do.
My name is Kelly Krighauser. I'm the social worker at the hospital here in Colby. Can you hear me okay? I am responsible, one of my roles at the hospital is responsible for doing advanced directives with patients. Do you guys know what advanced directives are? Do you have any? So advanced directives are, there's 3 different things. One is a do not resuscitate or a DNR. And basically that states that if your heart stops or you stop breathing, that you do not want resuscitated. So your providers will talk to you about this, but that's one of the jobs I do at the hospital too. The other one is a living will, and it's indicates if you have a incurable disease or illness determined by 2 physicians, do you want life-sustaining procedures done? The third one is durable power of attorney for healthcare, and that is who can make decisions for you if you're unable to. Those are things we do at the hospital. And I always tell people to make sure that the person you pick to make the decisions for you, they know what your wishes are. Because we don't talk about it. I'm usually the first one to talk to people about this at the hospital. Their loved ones don't feel comfortable talking about it. Lots of people don't want to talk about it because that means something bad might happen. So I'm usually the one that does that. So now, understanding that, do any of you have durable power of attorneys for healthcare? Perfect. We do them at the hospital. The clinics usually do them too. Any hospital will do them free of charge. So they discuss with you, they make copies, they make sure your family's involved. And we try to go over them every year in case something changes. So that's my main role. I did not tell Elaine I was going to talk about this, but I also recently experienced a death in my life. And we had to, well, at the hospital, I also work with patients that are dying, and I do funeral, like we talk about funeral arrangements, things like that. Once again, families don't want to talk to their loved ones about that, or the loved one doesn't want to talk to them about it. So my husband and I had talked about this several times. Every time I go to a funeral, I come up with a different song or something I want. And he recently passed away, and we had discussed his funeral arrangements. So it was so much easier for me to do that when I had to experience that. Anyway, I think it's a good thing to have that conversation about what your wishes are when you die and what you want. So also, as for you guys, especially, I don't have his voice on many things. He never left me messages, things like that. We just talked or text. And that's what technology is today. So leave your loved ones messages so they have them for the future. Sorry.
So if you have questions, raise your hand and they'll pick them up. And then, or you can stand up if you're loud enough, and you can ask any of us questions.
PBS, can you have it done again? Or is it a one-time thing only?
It's, they could go in 2 steps. You can get one installed if one side is worse than the other. And that's what
If you have it on both sides, but
I have it on both sides.
if it's not working anymore, can you do something different with it?
The only time it's not working is, for me, at this point, is the battery needs to be changed. Because I have run it out a couple times and it's miserable.
And when I was there last spring to see my movement specialist, she said, your batteries are getting low. I will talk to Dr. Van Sickle to schedule a battery replacement. So in July, I had both batteries changed. Now, one side my left side is worse than my right. And so it is a little bit higher on the left side than it is on the right. So when they were fairly close, but the left side was lower on juice. And I just had them both done at the same time.
David has had his since 2015. He's had his batteries changed. And we talked to the Medtronic representative today, and he said that the batteries can be changed to the adaptive battery so that they don't have to be preset. Right now, they set it and you walk or talk, whatever they're setting it for, and then they adjust it as it needs to be. But with the new technology, it will just automatically adjust itself. And even though he has the older style of DBS, he can use the new adaptive battery.
Okay. Can you stand up and speak a little louder, please?
Yes. He just got a new battery in July. This is actually the same day as Elaine. We didn't realize it, so we saw him there. And the next one won't be due until next year. But when it's due, then the way I understand it, they can put the adaptive battery in and replace both batteries with just the one. But we'll have to wait until that battery runs down enough so that the insurance will pay for it. The way I understand it, they won't touch any of the leads or anything, just the battery.
Percy? She asked why it took so long. I was sure I had Parkinson's in 2006. You can't shake on one side, both your legs and your arms, and then mom had it. But mom's Parkinson's was really only noticeable when she was stressed. Her dad get in a fight, or she'd be stressed about something. But mine wasn't that way. Well, the more stress I had, the worse it was. But I went to see her and she kept saying, you're working too hard, too much, you're not getting to sleep. And she just kept increasing my anxiety medicine. And when Dr. Van Sickle came in 15 and saw me and he had me walk. Well, first of all, he said, I haven't noticed any tremors. And Judy Taylor and I were sitting in the front row. She has essential tremors. And we Parkinson's people are the best con artists because we cross our legs, we cross our arms, we put them under the table, and nobody knows we're jiggling. Well, he said, I didn't notice anything. And I said, well, let me put my arms and hands out. And then he said, get up and walk for me. Well, I was already starting. You saw the old man on Dr. Sunny's picture. I was starting to get hunched over already then in 15. And at swimming, at water aerobics, one of the PAs said, boy, people are asking me if you're mad at him. Well, your muscles don't work in your face. You get mask face. And I said, I'm not mad at anybody. And then after I had DBS, Jackie said, I cannot believe your facial features. I love the smile in your eyes and your smile. But I didn't realize I was losing all that. And my soft voice. I played bridge with a friend and she was the head PT at the clinic. And I told her one time, if I ever need a service, you're the professional. You tell me, I'll get involved. I'll do what you think I need to do. Well, I was in there seeing a speech therapist for a soft voice. I was choking on the host and food. I was, what else? 3 things. So I saw the speech therapist 3 times a week. And then I saw the PT twice a week. And I saw the OT for urinary incontinence once a week. So can you imagine going to the hospital that many days a week? And after about 4 weeks, there were tears in my eyes every time I drove to the hospital. And I just thought, how can I stand this any longer? It interferes with my work, which I love. It just is no fun. And you're right. You don't go out and eat because you don't want to deal with people, because when they ask you how you're doing, you're always good, whether you are or not. And so especially when he had to cut my meat in public. And I always felt like, people were watching you. So but when Van Sickle diagnosed me, he flipped my arm. You have cogwheel issues in your joints and it pops. He said, feel that. Can you feel that joint just kind of, it's not connected like it's supposed to be because of the muscles. And then he said, I said, you know, I love to exercise. And he said, I can't believe what kind of shape you're in. And then he said, I want you to have a DAT scan. A DAT scan is to measure the dopamine in your brain. He was not happy that I'd seen a neurologist for 8 years. But when he got the DAT scan, the right side of my brain had 46% of the dopamine left, and the left side, which was not as bad at that time, had 54. Now you lose dopamine as you get older, but you don't lose it like Parkinson's people. And so he was angry when he got the results, and he called this neurologist up, and he had quite the discussion with her. And when he told me that, I went, oh, I still go with my mom. Is she going to throw me out? And she did not let you talk, did not let you have a phone in there. I mean, nothing. And I only answered questions about mom if she asked me. And so at the very end, she might say, do you think things are different, better, worse? But yet, I could not get that diagnosis out of her. And Van Sickle saw me that day. And then the reason why I remember my date that I was diagnosed was it was September 18th in 2015. And my birthday is September 19th. So it's not a day that I went back. And one of the things he did say to me, do you exercise a lot? And I said, yes. I do water aerobics. I love to walk. It just clears my mind. And so he said that's probably to some degree why it was more difficult for her to diagnose you. But he said, there's no excuse for 8 years. And so I went with my mom to the next appointment. And I told her what had happened. And she said, what are you going to do if she doesn't let you come in? And I said, well, I'll set out. I'm not going to argue with her. You need a driver. And so, but I did go in, didn't say anything unless I was asked. And so he didn't understand it. But again, I think so many of our neurologists and movement specialists have to see so many patients. They do not have time. My one in Kansas City had 15 minutes. When his watch went off, he got up and left. And the day that I wanted to talk DBS, I said, whoa, sit down. I'm not done with the discussion about my Parkinson's. I said, you had me wear a Medtronic watch, and I did. Do you have the results? Yes, I do. It's on my desk. He dashed and got it, showed it to me, and he said, I'm giving you a mantidine because you're off more than you're on with your carbidopa levodopa. Oh gosh, another drug. And then I was allergic to that. So I just went downhill more. I could hardly get to the front of the hospital walking from my car during those 5 or 6 times a week. And finally, one of the physical therapists said, you need to go to the clinic. You can't even, the PT or the speech therapist, because you can't even do the activities that I'm asking you to do because you don't have enough lung capacity. Well, that's when I found out I was allergic, and we stopped the mantidine. I thought maybe it was something else. So it was a long road, but I don't regret any of it now. Yes.
Yes, why they were so long to be diagnosed. And my husband was the same way. We didn't get him diagnosed till he was 80 years old, and he'd been sick for years, just like her. We'd been to every doctor within 100 miles trying to find out what was wrong with him. But he had the one he had inherited, the shaking, so they wouldn't go any further on checking it out. And so finally, in desperation, I called Mayo's in Minnesota, and we took him up there. And after they tested him, there was 3 surgeons said, yes, he has both. So I would advise you, don't let them put you off. Just keep going until you get the answer.
I didn't think I was stupid, but I didn't know there were someone higher, a medical person higher than a neurologist. Were the rest of you like that?
Yeah. So, yeah, you hear me? Can you hear me now?
Yes.
So I call that period of wandering in the desert, right? We went through the same thing where I think we wasted, in my example, 3 years of my life trying to figure out what the heck was wrong with me because of that. And so it's very frustrating. But once we found out what was truly happening and got that diagnosis, basically we just got tired of dealing with this person. And we went to a specialist, a neurologist that's a movement disorder specialist, has extra education to be able to handle the movement disorder stuff. I mean, they had me dialed in right away. 3 years. We could have been on top of this. Very frustrating.
So then I found out there were movement specialists. And so when Van Sickle diagnosed me, he sent me to a movement specialist. And I had severe problems with my eyes. I have a lot of difficulty reading. And so I do audiobooks now. But I found out not only do you have optometrists, you have neuro-ophthalmologists, you have optosurgeons, you have, I mean, and I'm in the best hands in Ann Schutz's eye clinic for my eyes. And if you have problems with your eyes, that's a good recommendation. Is Dr. Abbott is fantastic. We need our eyes all our life. Any other questions?
I have one for Kelly. I had my DNR and durable power of attorney and everything done like 20 years ago when I was sick. Should that stuff be reviewed and renewed, or is it just one time in your?
No, actually, you should review it every year. Because phone numbers change, addresses, things like that. You may want someone else, or if someone passes away, to put another person on there. So yes, I would review it each year if you can.
Well, it's time for the raffle. Colleen?